On Rwanda's border with the Democratic Republic of Congo, health workers in yellow vests are checking travellers' temperatures before allowing them to enter. Just across the border in the city of Goma, the death of a travelling pastor has sparked fears the disease could spread. Now Congo's Ebola outbreak has been declared a public health emergency of international concern by the World Health Organization. But the WHO has stopped short of calling it a global threat, saying the virus can still be contained regionally without travel bans.
That WHO does not recommend any restrictions on travel or trade, which rather than stopping Ebola can actually hamper the fight. Such restrictions force people to use informal and unmonitored border crossings, increasing the potential for the spread of disease.
A new Ebola vaccine is proving highly effective, but a looming shortage of the drug has health officials worried. Dosages have been halved to prevent a shortage.
That we have a gap in vaccine and there is limitation of supply. We wouldn't have been involved in adjusted doses if we had adequate supplies of vaccine available right now. So accelerating the availability of vaccine is a priority.
It's been almost a year since the latest Ebola outbreak began in the region. More than 1,600 people have died and twice as many have been infected. International donors are being asked to step up funding to stop the crisis from spreading further.
Let's get more on this story with Brianna Piazza. She's with the aid organization World Vision, and she joins us from Goma. Hi, Brianna. The WHO, as we heard, is calling this crisis in the DRC a public health emergency of international concern. You are in Goma, where the first case was detected there. How would you describe the situation where you are?
Look, thank you for having me. It's absolutely correct. This is becoming a critical point in the Ebola response. So since a case was confirmed in Goma and that person died, there's a lot of fear in the city of Goma. We're extremely concerned because Goma is a city of more than 1 million people, and it's very close to the border of Rwanda. And so although we haven't yet started to hear of multiple cases across the border, there is every chance that Ebola could spread further. And we've already seen more than 2,500 cases. Nearly 2/3 of those people have died, and 1/3 of cases are children. Their lives have been completely disrupted by Ebola. So the situation is very critical, and there's a lot of fear right now.
Brianna, as we heard, there is a vaccine that has been proven to be effective, but there is a shortage of that vaccine right now. Why is that? Why isn't it more available?
Look, vaccines are expensive, and as everybody knows, funding has been a critical issue in this response, not just for the World Health Organization, but for all aid agencies responding on the ground. World Vision doesn't administer vaccines. However, we would urge people to consider that prevention is just as crucial as treatment. So we can have vaccines, and I know that they're being administered to people who come into contact with people who have confirmed cases of Ebola. However, if we can reach communities and make sure that they're aware of what to do to prevent the spread of Ebola, to protect themselves from Ebola, then that's going to go a really long way to help contain the Ebola outbreak.
You mentioned prevention. This is also an area that's been described as a war zone. I mean, what is making it so difficult at this point to stop the spread of the virus?
That's right. There's more than 100 armed groups in North and South Kivu. So it's a very challenging situation for aid agencies and health workers to operate in. Just a few days ago, we even heard of 2 health workers who were assassinated, according to reports. So it's extremely challenging, and agencies and responders on the ground are doing everything they possibly can to contain Ebola and stop the outbreak. Although we are approaching 1 year since Ebola was first declared, I think agencies on the ground and the local health workers have done an amazing job to stop Ebola from jumping borders until recent weeks. So they've done fantastic work, but we need more support. And the threat of security incidents should not be used as an excuse for the international community to not do more.
All right, Brianna Piazza from World Vision joining us from Goma. Thank you very much.